Good evening and thank you for watching. Mika Miyashima has the night off. 17 more people on the islands were hospitalized for COVID-19 overnight. The Healthcare Association of Hawaii today reported 226 COVID patients are currently being treated across the state. That's about half the number reported in September when hospitalizations peaked at 473. That was during a surge by the Delta variant. Some health officials believe this latest wave of hospitalizations could peak in the next 2 weeks.
And that peak may be higher than the Delta surge. The infection rate and positivity rate from Omicron, as we know, are far greater than that of Delta.
While COVID hospitalizations are officially over 220 in Hawaii, does that number provide an accurate picture of the situation? KITV4's Jeremy Lee now joins us live tonight with a closer look. Jeremy.
Rick, as this new iteration of COVID spreads and fatality cases remain comparatively low, many have looked to hospitalization statistics to try to gauge Omicron's risk. Health officials have been consistent to say, take personal responsibility with all the tools at hand, but they have also explained how not all hospitalization cases are severe cases.
At least up until now, we have included in our counts everyone who tests positive for COVID, regardless of whether they're being treated for COVID.
Hilton Rathel of Healthcare Association of Hawaii says the practice has been standard. Included in COVID hospitalization counts are what are known as incidental admissions, he explained.
If someone comes off a moped, for example, has an accident, is admitted to the hospital, and they're being treated for that accident and they're tested, because we test all of our inpatients, it may be found that they have COVID and they didn't even know it, they don't have symptoms.
Still, that person is counted in the hospitalization count.
Does it cause inflation of the numbers? I guess I'd have to say yes, it does. But again, we think it's important to identify them for consistency reasons.
Healthcare providers say it's more of an issue now with the prevalence of Omicron. With its spread comes a higher volume of asymptomatic cases. How much do incidental admissions inflate hospitalization numbers?
Based on anecdotes, we believe that something like 20% they test positive for COVID, but they're not in hospital for COVID and are not actively being treated for COVID.
As for those who are hospitalized for COVID, there is an industry standard called the Milliman Care Guidelines.
The symptoms would have to be severe enough. They would have to have a significant shortness of breath. They'd have to have very low oxygen levels. They would have to have some other condition that would warrant them being admitted to the hospital and treated for COVID.
A physician I spoke with told me to get a true indication of COVID's continued risk, look at the fatalities, but also the ICU numbers as well. How many are admitted to intensive care as a result of the spread? Reporting live, Jeremy Lee, KITV4 Island News Tonight.